A lot of offices, I'm Laura from Front Office Rocks, working with Rohit still through this amazing technology that he has. And a lot of offices, mine included, focus a lot on new patients. In fact, my husband and I have had a practice since 2003. And until we started working with practice by numbers, that's all we focused on was more new patients, more new patients. And if we'd have a bad month, my husband would say, we need to market more. We need more new patients. Now that I'm working with so many clients with Front Office Rocks, and now that I've found practice by numbers, the biggest wake up call we had in my practice looking at this is that we weren't worried, we weren't paying too much attention to who was going out of the back door. So who was leaving the practice? Now, there's a lot of philosophy out there that is once a patient hasn't been in 12 months or 18 months or 24 months, you should inactivate them. That is not my philosophy, and I believe that you agree with me, Rohit,
Yes.
that you should be reaching out to patients all the time until either they say, don't call me again, I'm going somewhere else, or we get them back in, because nobody really looks out for their dental health besides us. Now I say that, and then I look at my numbers with Rohit recently and went, oh my gosh, we're, at 18 months, a patient hasn't been in 18 months, we're not doing a good job of getting them back in. So I wanted to go jump into this active patient part of practice by numbers and start to investigate, well, what does this mean? Where are they going? What numbers are we at? So that my team can get better about getting these patients back in. Because after 18 months, it is a long time for the patient not to be in our practice. So starting here on the top, Rohit, please kind of talk us through what that line is and what the new patients versus patients gone. And show us how we can start to track this more in our practice.
Absolutely, Laura. And hi, welcome back, everyone. So the top graph that we're seeing over here is that it's new patients entered, and it's showing it by the different referral sources. And the dotted line that you see down here, these are the patients that are going inactive every month. And what does it mean by a patient going inactive every month? What it means is that many number of patients haven't been in the practice for over 18 months. And that's how we track. But that's what we mean by an active patient in practice by numbers is 18 months.
Okay, so it's not necessarily people that we mark inactive in EagleSoft. It's just that we have not seen them in 18 months. So they're technically inactive in the sense of we need to get them back in.
Right. And it's based on heuristics, based on experience from many different consultants and practices that after 18 months, the likelihood of that patient coming back goes down significantly.
Yes.
Okay. All right, so shall I jump into the active patient discussion? All right,
yeah, sure.
So at this particular panel right here, what this is showing us is what is the number of active patients in the practice, and what does that mean? If you run a report in EagleSoft or Dentrix or OpenNettle, they'll give you a number that's probably same 2 times, 3 times, sometimes 10 times more, okay? Because what they're looking at is giving you is total number of patients, but a true count of your patients, active patients, is patients that you've done at least one or more procedure in the past 18 months. Okay, and that's what this number is measuring. 2,500 active patients in this practice that have been seen in the past 18 months. Let's dig a little bit deeper into that. So out of those 2,500 patients, 1,585 patients are active hygiene patients. And the way we calculate active hygiene is that the patient came back for a D0120, a recall exam, which is different in Canada, but we use the Canadian code. For US D0150, it came back at least once. So that means the patient has been back at least twice. Once when they were a new patient, they got prophy and exam and comprehensive, and then they came back again for D120. And that's what we count as active hygiene. Now, depending on the number of patients that you have in your practice, and the active patient, your number of hygiene patients will never really catch up to your active patients. I get it, because there'll always be those patients that you have seen in the past 6 months that quite haven't come back for a hygiene. But this number should be as high as possible, and this number should be close to your 9-month retention as possible. What that means is the patients that were active 9 months ago, they all, if they came back, they would have had their D120s done. Okay.
So in this case, what we're saying is only of the active patients in this example, 2516, only 1585 are active in hygiene or have had that code And
Right.
so they're only 62% of this. Now we know it should, I mean, it's not going to be 100, but 62, that's kind of a low number. That really can be increased or should be increased.
It definitely should be increased. Another way to look at this is active patients, 2,500. Out of that, I'm looking at the last 12 months. 585 patients have been seen in the last 12 months, new patients. So even if I exclude those 585 new patients from this 2,500, that means there should have been at least 2,000. So you can at least get to 2,000. So obviously there's opportunity here to bring those patients and put them in the hygiene fold. Okay.
Yes. And then and we're going to get into a ton more videos where we actually talk about how do we do that, right? Like, how do we reactivate? We have to pre-appoint, the verbal skills we use, that we're going to jump deeper into this. But right now we're looking at a high level to go, all right, well, we know we have an issue in this practice that we are not necessarily getting them into hygiene the way we should. One of the other things I want you to point out here that I think a lot of offices are interested in, and I think it's important to point out here, is this fee-for-service patient. So tell me, does that pull out of our software and keep us up to speed too on who's fee-for-service versus insurance?
Yeah, and this number is important for many practices, especially in this world where almost a lot of practices take PPOs. Fee-for-service patients can be godsend because these patients that come in, they pay you the full amount, and many times they're cash patients. And you want to track that. You want to see where you're getting from those fee-for-service patients, see if this fee-for-service patients is going up or down. And right. Every practice should be marketing towards those fee-for-service patients, because for any fee-for-service patient, you'll probably get 30% higher revenue than any PPO patient.
Okay. And then what is this active 12-month number down here below hygiene patient?
Yeah, that one we show the difference between how many patients you've seen in the past 18 months versus 12 months only. So if you want to change your definition, we should give you both 18 months and 12 months. And there have been few that people have said to look for 24 months also. I think 24 months is just way too long for a patient not to come into your practice.
Okay. That's excellent. Is there anything else we need to know in this area when it comes to it? Like I said, in other videos, we're going to talk about how to see if we're pre-appointing and per hygienist. I know it has that in there, and you know, how we're doing with getting patients diagnosed for perio and all the things we need to do to fill up hygiene. Is there anything else in these categories here that we should recognize that you think are important?
I think if we have time, we should cover the retention numbers.
I'll give you a couple more minutes. Why don't we do that since
all
we're
right,
all
let's do that.
Let's do it all.
All right, so it goes with active patient counts as well. So retention, 9-month and 12-month retention, meaning if you look at 12-month retention, in this office, we're looking at 68%. What does that mean? Patients that were active 12 months ago, if I counted every single one of those patients, created a list and seen which ones of those are still active, that number is 68%. What does that mean? 32% of patients in this practice have gone inactive. They've either been marked inactive or they've just gone inactive in the past 12 months.
Okay.
So for the office to stay at a level, active patient count, they have to replace 32% of patients every year.
Okay. Is there a way to tell which ones have been marked inactive versus went inactive or no?
Yes, actually, if you click on this list, it will give you a total list of every single patient that was either what their phone numbers, you can call them obviously, but it also shows right here if it was inactive. So this patient is active versus the other patient was inactive.
Okay, I see. So that is a good way for the doctor and office manager to see, like, and just as an example, I had an employee working for me who decided on her own that she was going to start inactivating patients, that they hadn't come in a year or two, and we didn't realize it for about 2 or 3 months. So we have a whole slew of patients that she inactivated that we wouldn't consider inactive. So but I don't know, by looking in my software, I don't know which one she did versus not, but I could use this to go through the list and really start to dig through who we've got marked inactive or who just hasn't been in 18 months.
Right.
Yeah, and that's what I love about Practice by Numbers is Eaglesoft, Dentrix, all the software are great, but it's not as interactive as Practice by Numbers can make it. My team can jump into one of these categories extrapolate from Eaglesoft the actual patient name, and we can get on the phone and start making a difference versus sitting around having meetings about it and looking at reports. So we're going to leave it that, because I think that this is enough for dentists and office managers to comprehend. It's not all about new patients. It's also about what's going on with your patients who aren't coming back. And the biggest thing here is we need to get our staff on the phones, calling the patients and getting them back in, because we're losing potentially as many patients as we're bringing in the front door, and that's not good for a practice.
Right. And in one of the videos, as you said, we'll go into how to create a reactivation program in your practice that's easy to follow.
That's
so
awesome.
It doesn't break the bank.
All right, so hopefully as people are learning your software, they can see how amazing it is, and how that, with a combination of Front Office Rocks and teaching your staff what to do and what to say, will really start to fix some of the issues that you have in your practice.
Yes. Awesome. Thanks a lot, Laura.
Thank you.